and I want to make sure that we have time for our discussion. So I'll get started and we'll let people join as they can. So I just want to welcome everyone. Thank you for joining us for today's Keeping Up with Knowledge translation session, which is hosted by the Maritime Spore Support Unit, or MSSU for short. If you're not familiar with the MSSU, we're one of 11 spore support units across Canada that support and conduct patient-oriented research. So we work in all 3 maritime provinces, so we have offices in New Brunswick, Nova Scotia, and Prince Edward Island. My name is Rachel Jackman-Tonio. I'm the Knowledge Translation Coordinator with the MSSU, and I'll be your host today. Before going further, I'd like to offer a land acknowledgement. I know that due to the brilliance of technology, some of you are near and some are far, so I invite you also to reflect on the lands where you live and work. My land acknowledgement is based on my location in Chibouctouc, or Halifax, and I'd like to begin by acknowledging that I am in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship, which Mi'kmaq and Wolastoqiyik people signed with the British Crown in 1725. The treaties did not deal with the surrender of lands and resources, but in fact recognized Mi'kmaq and Wolastoqiyik title and established the rules for what was to be an ongoing relationship between nations. We are all treaty people. We at the MSSU are committed to developing authentic and meaningful relationships with Indigenous communities and supporting the inclusion of diverse perspectives in healthcare research across the Maritimes. As a part of this commitment, we also recognize the histories, contributions, and legacies of the African Nova Scotian people who've been here for the last 400 years. So today's session focuses on how to sustain, spread, scale projects in order to translate learnings from healthcare research into healthcare practices and to generate real-world impact. And before we dive in, just a few housekeeping notes for everyone, if I can get this to change over. So first off, we are recording today, so you will receive a link to the session if you'd like to revisit portions of it. So please do mute your microphone when you're not speaking. We've enabled closed captioning, so if you'd like to have the captions running, you'll be able to turn those on in your settings. And if you have questions, feel free to type them into the chat. If you'd like me to call on you to ask them, just include your name next to the question, and I will call on you. So without further ado, I'd like to introduce our speakers. They'll each have 10 minutes to present. And our first speaker is April English. April is the Knowledge Translation Specialist with the Monitoring, Evaluation, and Knowledge Transfer Unit, or MECTU, at the New Brunswick Institute for Research, Data, and Training. Her primary role involves leading knowledge transfer efforts for the Healthy Seniors Pilot Project, or HSPP. April will introduce HSPP as well as the notions of sustainability, spread, and scale. Following April's presentation, we'll hear about 2 specific HSPP projects that are entering or transitioning to sustainability and scaling up. First, Jennifer Dobbelstein, a researcher and president of Dobbelstein Consulting Group, will present a research study, Home for Life, which is exploring the needs of elders in the Elsipogtog First Nation and implementing programs and services enabling elders to live home for life in their homes and in their communities. Following that, we'll hear from Dr. Suzanne Dupuis-Blanchard, who is a registered nurse with work experience in community health and aging, and a professor at the School of Nursing at the Université de Moncton, where she holds a research chair in population aging from the Consortium National de Formation en Santé, and is director of the Center on Aging. Dr. Dupuis-Blanchard will introduce Nursing Homes Without Walls, a provincial program for aging in place. Following the presentations, we should have about 25 minutes for a panel discussion. So hold on to those questions. We look forward to the dialogue then. And to get us started, I will stop sharing my screen and hand over to April.
Perfect. So I'm assuming Rachel, just give me a head nod if you can see. Perfect. Thank you so much. So thank you for the introductions, Rachel. So like Rachel said, my name is April English. I'm the Knowledge Transfer Specialist with the New Brunswick Institute for Research, Data, and Training. And I'll talk just a little bit about our unit specifically as well. But first off, I just wanted to lay the context before we jump into everything. So what is the Healthy Seniors Pilot Project? And for those of you who are on the call from Atlantic, Canada, you've probably heard about it before, but if not, we'll just give a bit of background into how we got to there today, and what the Healthy Seniors Pilot Project is. And so there's no surprise that New Brunswick is dealing with an aging population. In fact, New Brunswick ranks among the top jurisdictions for the highest proportion of older adults in the country, specifically ages 65 plus. In New Brunswick, older adults are more likely to live with chronic health conditions, have a disability, and to take multiple different prescription medications. So greater emphasis must be placed on supports and services that help older citizens in New Brunswick age safely, independently, and healthfully in the place of their choosing. And in 2018, the Common Statement for Principles on Shared Health Priorities mentioned that Canada's FPT governments have a commitment to working together to ensure healthcare systems continue to respond to the needs of Canadians. And then that same year in 2018, the government of Canada announced that they're investing $75 million in seniors' health. Specifically, they were calling it the Healthy Seniors Pilot Project. And this was with the government of New Brunswick, focusing on helping seniors to be active, live safely, and many, many more things. And so the Healthy Seniors Pilot Project, this $75 million investment, specifically by the Public Health Agency of Canada, which is overseen by the provincial levels of New Brunswick's Department of Social Development and Health. And like we mentioned before, it was launched in 2018, and originally it was just meant to be a couple years, but it has been extended to 2024. And so HSPP supports 65 individual, community, and government applied research initiatives in New Brunswick. We're a little bit different in that not only can academic institutions or professors apply to the funding, or they could in 2018, but we can also, we also do have community projects and government projects as well. And the projects aim to better support seniors in their homes, communities, care facilities, while promoting the healthy aging. And so our unit, the Monitoring, Evaluation, Knowledge Transfer Unit, was actually established that same year in 2018 to help support the Healthy Seniors Pilot Project with, as you guessed it, monitoring, evaluation, and knowledge transfer support. And so with the Healthy Seniors Pilot Project, there are 5 focus areas that each of the individual projects will fit under. I don't have time to go into detail about those today or individual projects in detail other than the 2 we have today. But if you want to learn more about the individual projects, I have the link on our screen there where you can search and learn more about the projects. And so one of the main questions that remain for us at the very beginning is, how can we successfully sustain the outcomes of these Healthy Seniors Pilot Projects? Pilot projects are being implemented, but we want to make sure that those that are successful in showing those positive evaluation results continue the outcomes on a population level. And I do think this is one of the most important implementation science questions to answer, because as we get better at designing and improving the way that we implement, spread, and scale effective initiatives, we need to be able to sustain our successes. Otherwise, we're kind of creating this pattern of implementing new and effective initiatives over and over again without reaping the benefits of all of those efforts. And so what is sustainability, spread, and scale to get us all on the same page today? First, I'm actually going to show this really nice visual that I saw on a webinar I attended recently. And it just put a really nice visual in terms of what is implementation, what is sustainability, what are all these gaps that we're talking about. And so many of you have probably heard of this research to practice gap, or the no-do gap. Many of you have probably heard that it takes approximately 17 years for research evidence to be fully adopted by practitioners and the public. But there's also an implementation to sustainability and scale-up gap. And so interventions we know to be effective from research studies are not delivered as intended, not delivered to scale, and not sustainable, and thus they're not yielding those wide-reaching benefits at the population level that we hope for. And there just tends to be a lot more resources invested at that discovery level rather than moving them into practice, implementing them well, and scaling them up to reach more individuals. And at HSPP, we wanted to flip that script and we wanted to close that implementation gap, because technically we view it as we're already closing the research to practice gap, because these are pilot projects. They're already putting their research into action and in the communities. But we wanted to make sure, again, we're closing that implementation gap to make sure those benefits are continuing on past the funding, that $75 million grant. And so there is a goal of sustaining 65% of our Healthy Seniors pilot projects post that $75 million funding. And some of our projects are already sustained or are looking into sustainability already and reaching out to partners, developing plans, thinking about that right now. But how did we get there in the first place? How have our projects already gotten there in the first place? Well, that's what we're going to talk about today, obviously. But again, I want to just put some definitions behind it all. I do want to just mention that I don't have time to go into the frameworks, theories, and models behind all of this, but I do love chatting about that. So if you want to chat, feel free to reach out. So before we get into sustainability, spread, and scale, we have to talk about knowledge translation, dissemination, and implementation science and practice. And so we at MEC2 and the Healthy Seniors Pilot Project see knowledge translation as an umbrella term that includes both dissemination and implementation science and practice. I wanted to put this into non-scientific language before we get into the scientific and jargony language. It just sets the stage really well. So this is pulled from a social media post from the Center for Implementation, who are an organization that we have worked with really closely. And they start with, implementation practice is basically like trying to convince your grandma to try a new recipe. Implementation science is the scientific approach to making sure Granny's new recipe actually sticks. And dissemination is like spreading the word about Granny's delicious new dish for everyone to know. So I really love that. But in jargony terms, for those who like it, dissemination is essentially the act of sharing information, kind of like what we're doing today. But one piece that's really important is tailoring those messages to particular target groups as well. Implementation science is a scientific study of how to move ideas and innovations into action. Implementation practice is more like that application of strategies to support people, organizations to use the evidence to actually change practice or policy, whatever it might be. And so as I mentioned before, implementation science and practice, underneath that is like the sustainability, or within that, I should say, is sustainability. One of the biggest challenges for sustainability is the lack of consistent definitions around the word. It means different things to different people, same with knowledge translation. But before you talk about sustainability, be clear on what you're trying to sustain, who needs to do the what to support sustainability. Those are really key pieces. So for us, we use this definition that has 5 components. So after a defined period of time, people continue to do the what. So again, the program, practice, guideline, it could be a policy as well. The how, i.e. the change strategies, continue to be delivered. The what and the how may evolve or adapt while continuing to produce those benefits, aka those outcomes for individuals or systems. Scale up is just a little bit more specific. Deliberate efforts to increase the impact of innovations successfully tested in pilot or experimental projects to benefit people and to foster policy and program development on a lasting basis. And even more specifically, spread, I took a really simple definition here, replicating it somewhere else. So let's say something's going on in New Brunswick and you want to extend it to all of Canada. That would be known as spread. And so why is sustainability important? Well, if your evaluation shows you're having an intended benefit, you want the benefit to continue and be available to more people. I think that's no surprise to folks here today. And one really concrete piece of guidance to include that if you plan for sustainability, you increase the chances of sustaining what you implement. And that might be kind of a no-brainer for some people, or might seem obvious, but you'd be surprised at how many of us don't explicitly plan for sustainability early on or at all. And so you can use a planning tool to help you think about your different perspectives, work through questions you might not have considered, and using a tool can help you identify those strengths and challenges for continued success. And this is exactly what our HSPPs are doing. They're using tools, resources, coaching from the Center for Implementation. We're doing fidelity checks now to help them think through sustainability of their projects. And I don't have time to go into each of these individually, but these are just 10 of the domains to consider when planning for sustainability and scale up. So just as one example, cost factors. Do you have the resources, the money available to, let's say, scale it up to the rest of Canada versus when you were just looking at like Fredericton, for example? It's a really big factor to consider. And so just to leave off today, I recommend starting to plan as early as possible, but starting at any stage is beneficial. You do not need to know if the thing is working before starting to plan for sustainability. But a key piece is you will need to have conversations about what to do if your evaluation shows that that thing is not having the benefit you want and whether it should be sustained. And so I'm just going to leave you with 3 common sustainability resource tools that can help you plan for sustainability. And now I'm going to pass it along to 2 of our HSPPs that are in that phase right now.
Okay, so Jennifer, you're next up. So I have shared my screen. Can everyone see that now? Jennifer's slides? Okay.
Yes.
I'll hand it over to you, and you can just let me know when to move ahead.
Sure, thank you very much. Good afternoon, everyone, and thank you, April and Rachel and Maritime Spore Unit for asking me to talk about our work today. It's a privilege to be here with you. April, great presentation to get us started. Good definitions, and that sets the groundwork nicely. So let's go to the next slide, please. All right, this work we're doing at LC Booktook began with Eva Sock. And sadly, in February of this year, after a sudden illness, Eva passed away. And I want to tell you for just a minute about Eva. Who was she? What did she accomplish? And how did she make a difference? She was a woman who left a huge legacy. She made a difference in her community, improving the quality of life of people, her own people. She was persistent and aimed for equality of Indigenous people with non-Indigenous people. She was a social worker with the BSW. She was Director of Primary Care and Intergovernmental Affairs for her community. And she was the longest serving past band manager, dealing with so many issues for more than 20 years with her finger on the pulse of the community. She was a representative for all Indigenous people in New Brunswick on the Health Council, New Brunswick Health Council. And I just want to tell you a quick story that the chief shared about Eva at her funeral. He was sitting beside another chief from a different community, and there had been an honor guard there for Eva. And the other chief said to Chief Sock, who is Eva's nephew, I didn't know Eva worked for the RCMP. And Chief Sock said to him, she didn't. They worked for her. So that's the kind of woman she was, and that's the kind of respect that she had from people. She cared deeply for her community. She loved her community despite all its challenges. And because of this, she had a vision and a mission. And with that, a plan of action always, resulting in transformational change. And I knew Eva for about 20 years. And 4 years ago or so, she called me and she invited me to come to the community and talk to her about the elders, because she was hearing from people on the ground level, working in home and community care and working with the elders in different capacities, that there were more and more issues concerns, and people wanted to get a grip on what are these, what are the priority needs, and what are the issues, and what can be done about them. So the Home for Life project was conceptualized, developed, submitted for funding, and initiated. And it was a Healthy Seniors pilot project. It resulted in program development, new processes, policy development, and is now a new mindset and a practice in the community. So in my mind, these make up the 5 Ps of sustainability. From project to practice also includes programs, processes, and policies. So project, programs, processes, policies, and practice. Okay, we'll go to the next slide, please. So we have to start with the team, and this isn't the whole team, but some of the team, and almost all the members of our team were from Elsie Booktook. Eva helped me select the members of the team, people who've had an interest in and experience in working with the elders. Many of our team members are elders and hold knowledge that is significant to help improve the lives of all elders. Based on what we've been doing, this is patient-orientated research. The goal of SPORE, improving the health of Maritimers through patient-orientated research. So we feel that resonated with me when I read it. The team members were nervous at the beginning of our work and unsure of what to expect. Our work began with education sessions. And these sessions were on topics such as research, teamwork, cultural safety, cultural competence, end-of-life care, dementia care, in-depth interviewing, focused ethnography, data management and analysis, things like that. When we went into these sessions, our intent was to teach skills and share information. I found, though, that it was a two-way process of half teaching and half learning, because I was learning. I had experience working with First Nation communities previously in all of Atlantic, but there's so much to learn when you're learning a new culture and the ways of the people, the traditions, the values, the ways of thinking. And you can teach and teach and teach, but if the information isn't being received and accepted by people in a different culture, then you need to know. So I learned very quickly when there was silence from the elders on our team that I had to stop and say, what's wrong and what are you thinking about this and where do we go with this? So that was really important, that the education sessions were a two-way process, and important to remember, to be open to learning and to accept that you don't know all of the things that you need to know, and that you need to trust what's being said to you and accept it. Okay, I want to also say that when COVID-19 came along, our first plan was to keep moving forward. We had 3 milestones to accomplish: to conduct our research, to implement new programs, and to develop the Home for Life assessment tool. So we proceeded. And with a safety protocol in place, we met off-site when we were not able to go into the community. Soon enough, our team got us a staff pass for our car, so we could go in, and that was great. We developed the whole concept of a community-based research team, and we switched focus from doing the research myself as the primary investigator with Eva, but instead of that, we allowed and focused on and developed the capacity of the team to do the research, so that all the research interviewing could be done in Mi'kmaq and make the participants that were answering the questions feel at home and feel safe and feel that they were expressing themselves in their own language. Program implementation, okay. We did, sorry, I'm just checking my spot here. So yes, the other things that followed at this point were our plan of action, our program implementation based on our findings, our working with the planning committee to implement new programs, and our program evaluation was occurring concurrently. And then at the end, we developed our Home for Life assessment tool. Next slide, please. Okay, one more slide, sorry. There we go. So this picture shows some of the programs that we did develop. The priority coming out of the findings was food insecurity. So we developed the Meals to Go program. And you can see the ladies on the team delivering meals and a sample of what the meals looked like and putting boxes together and so on. Okay, next slide, please. I want to make sure I'm not going too long here. I'll kind of try and watch the time. So then we came to the final finding, the big finding, which really changed from the deadline of our project funding to the new idea for our next project, which really means sustaining what we were doing and adding to it, which was to consider the fact that supportive housing was needed, came through loud and clear in our findings. So this picture depicts, of course, a traditional home, which is now used mainly for ceremonies. And every day, in fact, one of the participants in our study spoke about going to do the sunrise ceremony in this teepee with his daughter, and that they didn't miss. They went every day to do welcoming of the sun and the morning. So that's what this home is used for now. Okay, we'll go to the next picture. This is the proposed design for the new assisted living lodge. And so this takes us to our proposal to build an assisted living facility in the community. And you'll maybe notice that this is in the shape of a turtle. The turtle, of course, is for protection. And that was asked for by the elders in the community. We had extensive engagement sessions with the architect and with the constructors before we went to application for the funding for this facility. So even the things like the colors to be used in the facility were discussed by the team. And one lady on the team said, we want native colors. We don't want gray, black, or white. We want orange, green, brown, fall colors, you know, like Mother Earth and so on. So the architect loved that. He said, we'll do that. So we have a great hall here in the middle, you'll see on the left side, and the wings, 3 different wings for 30-bed assisted living facility. Okay, next slide, please. So we looked into funding opportunities and options, and we met with CMHC, and we were advised to submit under the Rapid Housing Initiative, which is a grant program, not a loan program. And the application deadline for that was last week. So now I have very little bit on my shoulders anymore because the weight of that has come off, and I can be happy that it's submitted. I think we have a good application. We had a good partnership along the way. It meant so much to us, the assistance that we received from the CMHC expert and the constructors and the chief and band manager at Elsipogtog, as well as from our team that did the research, were crucial in getting this grant application together. Okay, we'll go to the next. Now, this slide is about the video that we produced, and the chief of the community asked that we produce the video, having the elders express themselves about the need for the long-term, for the assisted living facility. And so the first thing we did was try to figure out the best way to do that. So I asked the team, who would be good in the community? Who knows, who's a videographer in the community? And they said, well, there's this one person, this guy, but he doesn't have a car, and we don't know if he'd be able to come to the meetings. And they thought it all out, whether this guy would be the one or not. And then they said, there's a girl, and she's starting to take pictures and do photography and videography. So Tamara is in the right-hand corner, and she was selected as the videographer for this project. And she is a fish biologist, actually, marine biology is her degree, and she has photography and videography as a second career. And her assistant, you'll see on the left, is her boyfriend, Kurt. And what they did was take the time to come to meet with the elders and talk about what was this research project? Why are you making this video? What is it all about? And so they really, really figured out, like, you know, what this was about. They just didn't come take pictures or listen. They got it. They really, really did. And they were excellent with the people, and the people are familiar with them. And they understood some of the Mi'kmaq language, and they knew that when the elders started to speak in their language, they would soon translate and start to say what they were talking about. So it was comfortable. It was wonderful. So the video is coming up next, and I'm going to ask Rachel to play it.
So I'm going to get myself off mute. Jennifer, I hope that you don't mind. We're running a little bit late on time. And so I was thinking, could we hold the video for the end, and people that have time to stay will play it. And what I will do is there's an email that goes out to everyone who's registered after the event, and I will include the link to the video in there to make sure that everyone has it. It really is a wonderful opportunity to hear directly from elders. So I will play it at the end if people are able to stay, but is it okay if we press on the moment?
I just have 2 slides after that, which I can leave. If you would play the video now, I think that'd be good, and then we could finish after that. Okay.
Okay,
so
we'll squeak it in now, and then we'll move on to Suzanne afterwards.
Thank you.
Thanks for understanding, Jennifer. Okay, let me try to switch up here. Just a minute. I have got to get, I'm going to do stop share for just a second while I bring up the video. Okay. Here we go. So go here. Just a minute, and then I just need to share my sound as well. Hang on. Oh, now Zoom seems to. Just a second. There we go. Okay, so I'm going to share my sound, and here we go.
People's home, they'll provide all that for us. That's why we need it so much. Yeah. It's medicine for us. Ako, nigatto ko si Mikti Shebi Teluisi. Ni Migame Wisk. My Mi'kmaq name is Thunderbird Turtle Woman. My spirit name is very important to me because it represents who I am, and many times our spirit names were taken away from us. When we think back to residential schools, a lot of our elders, they had attended residential schools. And so when the elders are taken out of the community in an old age home per se, they're still feeling that trauma that they experienced in the residential schools, being taken out of the community, having that extreme loneliness, missing their people, missing their culture, missing their traditional foods. We need to have something here that accommodates our culture. That is different, that's unique. It is so important to have an elder-assisted facility here within our own community.
Right now, we have people in hospitals waiting to be placed in nursing home. We have a long list. We have people in special care home, and we even have 30 people that are living at home that should be in a nursing home.
Nobody comes to shovel my steps, somebody said. I have to do it myself. The other one said, my home is not equipped for me as I age. I need ramps. I need grab rails for the bathrooms. I need a walk-in shower and things like that.
There's lots of things in my bathroom that's not suited for me, not now. It used to be.
We've watched our elders being put in homes. We've watched them and we've watched them deteriorate. They don't talk anymore. Next time we go, they feel worse. And then they just deteriorated and finally just died of loneliness. This nursing home is really urgent and it's critical and it's long overdue. We need it.
My name is Robert Levi. I was a former chief in my community, a band counselor. I first became a band counselor in 1989. I became a chief in 96 till 2004. I left a little bit. I came back in politics 2010. Became a counselor again for another 8 years. What's happening is, we've got, I think, almost 200 of our community members, including myself, that are over 65. And so every year we're starting to get, a lot of them are getting up there in the age. And in fact, we got quite a few of them now that are in senior homes off the reserve. And it's hard for them. First thing is the language, because they don't speak Mi'kmaq there. So you'll have one or two people by themselves and they won't understand what's going on. While they're here, we supply them a lot with the fish, and we also have our moose hunt that we're able to send our people out and bring back the meat to the members. See, they're going to miss that, so they want all that in here, right, in our community. Right now, I think there's over 4,000 people in this community, and yes, security also is a very big concern for them. Be able to join in their friends as they get old and in comfort, and be able to speak in their language, to be able to eat the food that they ate and not worry about anybody coming in and breaking in. To have it in their community, and that's what the biggest thing I'm hearing.
For we are all related.
It's a really wonderful video, Jennifer. Oh, you're on mute.
Thank you.
Yeah, and we will still include the link in the email so people will have a chance to go back and visit, but it was wonderful to hear from the elders themselves. So I will have to kind of pass us off to Suzanne to make sure that we have time to hear about that project as well, but please, if you have questions, we'll have a chance to all talk in a few minutes.
All right, well, thank you. And that was two great presentations. And Jennifer, that video was actually worth watching for sure. So I believe I'm sharing my screen. Yes. Okay, perfect. So as was said in the beginning, I'm here to speak about my seniors pilot project, which is Nursing Home Without Walls. And I would just like to acknowledge the partners of the Nursing Home Without Walls project, the 4 nursing homes in the project, as well as, of course, the funders. I'll jump right into it. So Nursing Home Without Walls was an idea that came about from our research, but also from different brainstorming with different groups in the community, including the New Brunswick Association of Nursing Homes, to try to find sort of that niche for the future of nursing homes, but at the same time thinking about population aging and the fact that 92% of older adults are actually aging at home and not necessarily in nursing homes. And from my past research, we had certainly documented the lack of access to certain services, not necessarily that the services were not there oftentimes, but that seniors did not know how to access them. And there were plenty of other concerns. And so the idea of Nursing Home Without Walls was kind of built around that with the goal of being able to keep older adults aging in place. With appropriate supports. And the Healthy Seniors Pilot Project gave us the opportunity to get the funding to provide extra resources to the nursing homes for additional staff to do the project. So the intent was never and is not to add to the workload of the workers in nursing homes, but instead adding appropriate resources for that. And when I say appropriate, it doesn't always have to be a health professional in the instance of Nursing Home Without Walls. It could be community developers, it could be an LPN, or it could also be a nurse, but it really depends. And you will see as I get into a brief description here. So there were 4 objectives. The objectives of providing access to appropriate information and services, social health initiatives, because people were very much concerned about social isolation and loneliness. Also being able to provide knowledge on how to stay healthy or keep healthy, and also empower the local community in supporting population aging by becoming an age-friendly community. The 4 pilot sites from the HSPP are Lamec, Inkerman, Packageville, so in the Acadian Peninsula, and Port Elgin in Southeast New Brunswick. The Nursing Home Without Walls model or project is really an umbrella term, if I can say, that has the goal of staying or remaining flexible to answer to the needs of the seniors in local communities. And when I say that, it's the fact that the sites of the project had a really good understanding of the needs of the seniors in their communities, and were able to tweak or adapt Nursing Home Without Walls for the priorities in their communities. And what has come out of the 4 sites in the pilot project are sort of these 4 different aspects of the project. The first one, which is more of the navigation, but it's a lot more than navigation. I would actually prefer to call it almost accompaniment to the services, because oftentimes providing general information about the services, or providing a phone number, like even talking about the 211 service that we have here in New Brunswick, was not sufficient for seniors to actually get the services in their homes. Oftentimes, our coordinators of the project had to meet with the seniors and do even 3-way calls with the service providers, fill out the forms, really guide the application process, but also do the follow-ups to make sure that everything was submitted correctly and that the request was being studied, and also making sure that the services, once they're received, was helping the senior, and that it was the appropriate service. We also, of course, are providing the social health initiatives for social isolation and loneliness. And this has taken a different, looks different in every community. So it could be from group activities to having friendly calls and friendly visits. We have a buddy system where the seniors visit other seniors and have a social visit, not necessarily an outing, but a visit. We also do the caregiver respite with a volunteer visitor program. We've used the community radio to provide programming, and that came in quite handy during the pandemic. And we also have a community where Nursing Home Without Walls is more of an interaction between community and the nursing home. So they provide baiting, social activities, and meals to seniors in the community who need a bit more support to be able to remain at home. And so a number of seniors go into the nursing home for a half day or a full day. And like I said, you know, for personal care, socialization with the residents, and they stay for a good meal and go home with a few meals as well. And staff also do home visits with those older adults as well. And there are social outings and, again, some navigation of services as well that happens there. In addition to all of that, there's also more of the supportive services that are being provided as well. And I was listening to Jennifer's video when they said, you know, someone to clean my steps from the snow and whatnot. And we are actually doing that. And right now it's one of our most popular services this winter, because no one does that, right? You get your driveway clean, but what happens to the steps and the snow in front of the garage or whatnot? And so we are providing that. We are providing coordination with a foot care provider as well, house maintenance inside, outside, and all of that in trying to get these communities to adapt or adopt age-friendly communities principles. And I know I'm close to my time. Just a quick overview. We are actually over that number right now, but just to give you an overview of who the participants in Nursing Home Without Walls are. So many are in their 80s, 62% female, many with no post-secondary education, and about half with an income of 25,000 or below. And they are very much at risk of frailty. So we feel like we are getting them when they are sort of in that gray zone where they are not, and I'm using air quotes here, but sick enough to qualify for certain services, but they are not fully independent either. And so Nursing Home Without Walls is able to provide them with just enough support to be able to age in place. In our evaluations and in the feedback that we get continually, you know, I'm so happy. I can't stop crying. There is no way I could have spent another winter in my home. Nursing Home Without Wall has literally saved my life. My mother is a new person. She now smiles and has something to look forward to, especially when she knows that an activity is coming up or that she's participating in something around Nursing Home Without Walls, and also around the information and the links that were provided that are a huge help. And so just to finish up, I always use this quote, Nursing Home Without Walls sees the possibilities when seniors see the barriers. This is one of our participants who said that. And I think it says a lot about what we're doing. And in conclusion, I would just add that we are also getting lots of interest from other provinces around this project. And the provincial government has announced in the November 2021 now health plan that they would adopt or expand Nursing Home Without Walls. And so I can't speak to that, but I will say that there are discussions happening, of course, around that, but also around other provinces that are hearing about this, and a few homes even in Saskatchewan and in other provinces that are interested in talking more about this. So thank you very much. I hope that was not too quick, but sufficient.
Thank you to all of our speakers. It was really interesting to start with the story of HSPP and this large project, and then to hear from both you, Jennifer and Suzanne, about what that looks like in communities, how these projects are adapting and engaging with people to find solutions that work for them, and then how we can learn from those in other contexts. So at this point, I'd like to open it up to the floor. And I see we have our first question. Just a reminder to everyone, if you want to drop your questions in the chat, if you put your name alongside it, I'll call on you and you can ask. Otherwise, I'll just put them to our speakers. Our first question, they say, thank you for the excellent presentations. And the question is for Suzanne. Did participants continue to visit long-term care homes during the pandemic? So were there opportunities to go in person?
Yes, definitely. Not the first few months, of course, because everyone was in crisis. But eventually we did present a plan to public health. And so to show how we would do this safely and whatnot. And so instead of getting a few seniors coming in, we were allowed to bring one person in at a time per day, take precautions and whatnot. And so that finally happened. In many of the communities, the older adults do not necessarily go into the nursing home. It's more the coordinators of the project that do the home visits or whatnot. And in that sense, we actually got busier. I can say that we saw a huge increase in the number of calls that we were receiving to participate in social activities or things like that. It was really fascinating to see, and I think it's the loneliness and the social isolation that really brought that out.
I think it's really interesting as well how that idea of social health came across. Suzanne, you brought that up in your presentation, and Jennifer, it kind of made me think about the layout of that proposed facility as well, how there was that sort of grand hall built into the turtle design. I wondered if you wanted to say a little bit more about how working with communities helps to understand the notions of social health in different settings.
Sorry,
Either Jennifer.
Suzanne. Go ahead, Suzanne, if you'd like to.
Oh, I thought the question was for you, Jennifer. That's why. Well, the social health aspect is so important. I'll just start with that and I'll hand it off to you, Jennifer. It is so important. And there's even new literature coming out around the importance of what they're, the concept of social prescribing, because we are realizing that a lot of even the physical conditions that are coming up, and even mental health wise and whatnot, the importance of being connected socially, and that can look very different depending on people. Some people will say, well, I don't usually go out, or, well, still feeling that connection will make a difference. And I think looking at that design, and I'll hand it off to you, Jennifer, but looking at that design of that that nursing home, I mean, I think it's just wonderful to see how they've allowed space for that. And I think some of the nursing homes in Nursing Home Without Walls would even say adding a wing for community care or something like that, just kind of being innovative in that sense. Jennifer?
Thank you. And I really enjoyed your talk, Suzanne, and it made me want to ask you if the Nursing Home Without Walls could be considered for First Nation communities. So we have a talk there at some point.
Yeah, well, I'm actually meeting with the First Nations community at the end of March. Next week, I think the end of next week, to discuss this and to see if it's pertinent even without a nursing home, right? So could their healthcare center provide some of the services that are needed for the elders to be able to age in place and age there, and not necessarily. So that's why when I was listening to the video and them talking about their needs and the people that are home and whatnot, and I thought, oh, geez, this is exactly what, and that's the conversation that I had with, it's not Elsipogtog, so it's another another community, but definitely. Yeah.
Okay. In regard to social health, I'll share a little story with you about our Meals to Go program, which of course was designed for meeting the needs around food insecurity. However, an organization on reserve at Elsipogtog was the organization to provide the meals, which was CC's Entertainment Center, which has a kitchen. And we had a contract with them to have certain conditions met, and that were important. And we had feedback from the managers at the health center about what requirements we should have involved, and we followed that. However, it ended up being just as much a benefit to people's social health as to their nutritional needs. The owner of CC's, Kara Simon, said she would be willing, after the COVID restrictions, to open up the large room for elders to sit together, not just to pick up their meals and have meals to go, but to sit down and eat together and catch up and talk to each other. Yeah. And this was huge in COVID, to be able to just talk to their neighbors and be with other people. And Indigenous people love to tease each other, and they love to laugh and joke more than we do even. They tease each other to death. And that fun can happen, and that can lift people up and really benefit them socially. And we were told in our research data that the assisted living facility will also help in that way, to be able to sit with others and enjoy not only people's own family, but their neighbors and other families that are there. And the need for a playground outside to watch the grandchildren play because there are so many grandchildren to visit. And so the social health element goes hand in hand and is vital in my opinion.
Definitely. I agree with that.
Yep. And it's interesting too, in listening to you talk, the idea of spread is sort of coming up. Suzanne, you have another community that you're starting to work with, and how these ideas catch on. And I wonder if bringing it back to the notions of sort of sustainability and spread and scale, are there 2 or 3 strategies that you can share, things that you've learned or that may help others who are on this path of moving from a pilot project to a sort of more sustained piece of work?
Yeah, great question. The first thing that comes to mind, I think, is you have to think about sustainability right from the beginning. And April said that quite clearly as well. And it was always our concern to get, older adults dependent on Nursing Home Without Walls and then disappear after the 2 years. So we've been talking and thinking about this right from the get-go. And we know it comes down to funding, right? It comes down to being able to have staff in place and to be able to provide the services, because, as much as the major expense, if I back up, our staff. We don't necessarily offer any services. We link people to the services, and yes, we will help with transportation and things like that. But so the sustainability and spread part for me was very much based on continued discussions and relationships with key stakeholders, be it the HSPP, if I can say people or office or the whole team, but also keeping government informed of what we were hearing, what we were seeing, and taking opportunities that were provided to all HSPP teams to be able to share what works and doesn't work. Right? Like it's for me, it was an ongoing process of looking at, okay, our successes, the challenges and how we respond to those challenges, but making them known as well. And so I think an open communication and talking about those and talking about the project. Especially when you have successes, right? I guess it's easier that way. But even just taking opportunities at conferences or at different venues where sometimes, as a researcher, if I can say that in a polite way, you think, oh, am I losing my time here? But you always get to reach someone who will be curious and who's connected to someone else, And to me, it's all about the connections and taking opportunities to have those conversations. And in fact, the Port Elgin site has a long time ago used up its funding from HSPP, and we have another funder in place right now in collaboration, though, with government. It's shared funding, but that partner would never had identified us if we wouldn't have had those conversations. Yeah.
I think that's a really good point about the connections. Jennifer, I don't know if you want to add some of your own experience with this.
Sure, I'll just briefly say that my dear friend and colleague Eva Sock used to be known for saying, if it's to be, it's up to me. And our team talked about this, and now we say, if it's to be, it's up to us. Like we're still here, and we're going to go forward to do what needs to be done to sustain what we have and to enhance and add to it to meet the needs that have been identified. To me, it's the thing that's at the root of this is what Suzanne mentioned: sincere relationships with people, all of the people that step up to join you because they believe in what you're doing, they support it, they do whatever they can to connect you to other organizations and people that lead to things happening. April has been an excellent connector for me. I have been away on a trip when deadlines are coming, and she'll help do something to connect me to people that's made a difference, and I appreciate her always for that. Also, I must say, co-production of the research with the people from the community, that creates ownership and that creates sustainability. It's theirs. It's their community. It's their work. They know it. I'm not
Mhm.
telling them the findings. They have felt the findings. So that's vital. I know time is running out. I'm going to watch the time at the end. Sorry that I took a little bit too much time
it's
earlier.
great, and I love kind of wrapping up on that. If it's going to be, it's up to us. I think that's a really important message. And April, I know we haven't really brought you into the conversation, so I want to give you at the last moments a chance to weigh in if you'd like to as well. I know you have a view across several HSPP projects. And I saw you nodding a bit with the connections.
Yeah, I think Suzanne and Jennifer took the words right out of my mouth. That's exactly what I would have said. Establishing partnerships and collaborations that do support your sustainability efforts is key. And I was just going to say on to Jennifer's point, the co-production involving those impacted by the initiative is just so important. Yeah, I think they took the words out of my mouth.
Great, thanks everyone. So we are coming on 1 o'clock. I'll end, there's one last comment in the chat. This is from Marina Hamilton, who is the MSSU director, and she just says, thank you for presenting today and sharing your knowledge in these successful projects. Very interesting and great to see the positive impact they've had. And I want to join her in thanking all of our presenters for joining us and all of those participants who are here and sharing in the discussion, as well as my colleagues who help with these sessions. We will be sending around an email that will have an evaluation link. So please take a minute to tell us about your experience of the session, and we'll also include the link to the video that Jennifer shared. And also, April, I think I'll follow up and get links to those resources for sustainability that you shared in the beginning. So we'll get those in there as well. So just thanks again, everyone, for joining us, and I hope you have a great afternoon.
Thank you.
Thank you.
Thanks.
Thank you.
Bye, everyone.
Bye.